Pelvic pain is a series of symptoms that causes distress within the pelvic region. This could include pain, urgency, frequency, waking at night, just generalized discomforts, feeling like you're sitting on something, pains that radiate into the stomach, and pains that radiate into the legs. Symptoms of pelvic pain obviously include pain, but also include urgency, frequency, waking at night to go to the bathroom, pain like they're sitting on something, pain during movement, pain holding in their bladder. Many people feel like they have prostate infections or bladder infections, and this could be very debilitating for many patients. Unfortunately, there's no clear reason why patients experience pelvic pain, and often it is a diagnosis of exclusion. In other words, we have to rule out other syndromes like infections or growths that cause pain. We do think about things like constant infections, stones, prostate abnormalities, muscle dysfunction, muscle spasms as a generalized approach to pelvic pain. There are many different treatment options for pelvic pain. This can include physical therapy, antibiotics, overactive bladder medications, medications to help with depression and anxiety, medications that get put inside of our bladder, and sometimes we have to do needle blocks to help numb a nerve to make people feel better. The risks of untreated pelvic pain include obviously ongoing pain. We always worry about missing a diagnosis, which would be awful for a patient. But also, there's clear data that the chemistry of our brain changes when we're having constant pain. Often when I treat patients for pelvic pain, I involve a pelvic floor physical therapist who is a physical therapist who specializes in pelvic anatomy. Sometimes I involve pain management. I almost always involve the patient's primary care physician and/or gynecologist. And sometimes I have to involve a psychologist or psychiatrist for my advanced cases.